Are you suffering from pain on the side of your knee and you're wondering what the cause could be? If you are, hopefully this video will have the answer for you today. My name is Harlow and I'm the Over-Fifties Specialist Physio here at HT Physio in Farnham. And today we're going to be talking about pain on the inside of the knee and the most common causes of that problem. Now, before we dive into the content of the video, please, if you haven't already, consider liking this video and subscribing to the channel because you'll be the first to know when new videos come about, and it really helps me reach more people, so I'd be eternally grateful. Anyway, let's talk about pain on the inside of the knee. So just to show you the inside of the knee on this model, this is my knee model here, and if you're looking at this knee, this is actually a right knee, so it might be flipped in the video, but really we've got the outside of the knee is here, the inside of the knee is here. So we have the kneecap on top, we have the thigh bone here, which is this long one, it's cut across there. We have the shin bone here underneath, again that's cut across on the bottom. And then we have the fibula, which is a small bone which goes on the outside of the leg. And those are the bones that make up the knee. Now, if we look at the inside of the knee, we've got this structure here, which is a ligament called the medial collateral ligament. And then if we bend the knee, we can see inside there, we've got something called the medial meniscus, which is like a shock absorber. So those are really the key points of the knee in the skeletal structure. This diagram doesn't show muscles, but in reality, we have muscles at the front of the leg here, muscles at the back of the leg here and here, and we also have some muscles at the front of the shin as well. There's no muscles directly over here, but we do have things that attach to it. So let's talk about what can go wrong for pain on the inside of the knee. So the first cause of pain on the inside of the knee is arthritis. Now, knee arthritis is basically the process of cartilage loss between the bones. And if the pain is on the inside of your knee with arthritis, it's typically over the joint line. Sometimes it can spread out a bit and even come down into the shin. But if we're talking about arthritis on the inside of the knee, usually the arthritis is occurring here. So between the femur, which is the thigh bone, and the tibia, which is the shin bone. And you can identify arthritis on the inside of the knee because it will be sore to weight bear on, it will be stiff, especially in the mornings for the first 10 minutes. Sometimes it will feel like the knee is going to give way and you might get some clicking or clunking. So that is often a sign of knee arthritis. Typically affects people over the ages of 50. In rare cases, it can happen before then, particularly for ex-athletes and people like that. But the vast majority of people are in their 60s and 70s. So that's the first cause. The second cause of pain on the inside of the knee is a meniscus tear. So that shock absorber we spoke about here, this is called the medial meniscus, so it's on the inside of the knee. It's very tightly attached to your shin bone, which means that it doesn't like twisting. So a meniscus injury can occur when we twist, when the foot is planted, okay? So it can occur like that. And because it's got nowhere to go, because it's quite tightly bound down, you can get little tears in the meniscus, which can be painful. Now, the key sign of a meniscus tear is tenderness to touch over the side of the joint line. So if you find the space between the two bones, the space between your thigh bone and your shin bone, and you rub your finger up and down the inside of the knee, if you touch something and it kind of makes you jump and it's quite sore, then it could well be a meniscus injury. There's two types of meniscus injury. I spoke about both of these types on my previous video. The video is called The Two Types of Meniscus Tear, and you can find a link to that below this video. But with a meniscus tear, you can have two different types. You can have an acute injury, which happens suddenly, or you can have a degenerative injury, which happens very slowly over time and looks quite a lot like arthritis. Now, both of these meniscus problems can be improved. They can't always be fixed, but they can definitely be improved. So if you're not sure, make sure someone has a look at you. So those are the two first injuries we need to speak about, and they're probably the two most common causes of pain on the inside of the knee. Now, the third injury that can occur to the inside of the knee is an injury to this ligament here, the medial collateral ligament. Now, your knee joint is, even though it's quite a complicated joint, it has two movements, forward and back. So you can extend your knee and you can bend it. Now, the reason we can't take our knee side to side is because we have ligaments. These ones here, so the medial collateral, and the one on the outside called the lateral collateral. Now, this is actually a common place to get an injury in sport. And you can get an injury to the medial collateral ligament if someone makes contact with your knee from the outside. Okay, so if they hit you this way, the force goes that way, and it can just open up the space between these two bones, and you can tear some or all of the fibers in this ligament. Now, typically it's a very painful injury. It's one that can cause you to not be able to weight bear for a few minutes afterwards. If it's very severe, you'll feel that the knee is unsteady and that it's moving when it shouldn't be. And unfortunately, this injury can often happen with other injuries to the knee at the same time. So we tend to be a little bit concerned when we see people with medial collateral injuries. Now, luckily, this ligament doesn't tend to degenerate over time. So it's not something that happens with age. It only really happens with trauma or with twisting or a direct contact injury. So that's a ligament injury. Now, another thing that can cause pain on the inside of the knee, if the pain starts to move around to the front, even though it's still on the inside, if the pain is around here in the knee, that can sometimes be a patellofemoral joint problem. So a problem with the way the kneecap is moving on top of the femur, which is the thigh bone. So injuries to this area typically cause swelling. They typically cause pain when you lock the knee out or when you fully bend it. And often the pain is worse when you're coming downstairs. That tends to be a key marker of this injury. Now, often the pain here is not on the side, so it's further to the front. So if your pain is round the back of the knee, it's almost certainly not a patellofemoral joint injury. But if it's round the inside and the front, it could be a problem with this joint here. Now, the other common causes of knee pain can be to do with different joints entirely. So it's quite common to get referred pain from the hip. Okay, if someone has an arthritic hip, quite often what we see is pain that goes all the way down the leg, sometimes settling on the inside of the knee. And I've even had patients who've come in to see me and they came in with knee pain. We've had a look at them, their knee is actually okay, and then we look at their hip and the problem is actually up in the hip. But the brain has a funny way of interpreting pain sometimes, and it can actually recognize pain from different areas than the area that has the problem. So quite often people can have knee pain on the inside when the problem is further up. This is another reason why it's really important to get checked out by a professional. And then the final cause of pain on the inside of the knee that we're going to speak about today is a pain referred from the lower back. Now, if you have pain that starts in your back or your buttock and it wraps around the front of your knee, so it goes down the thigh to the inside of the knee, that is a very common sign to suggest that you have a back injury causing the pain in your leg. And the reason a back injury can cause pain in your knee is because you have nerves that go from your back down into your knee. Now, if the pain is wrapping around the front of the leg to the inside of the knee, as we just mentioned, that suggests that it is the L4 nerve. So the second nerve up from the base of the spine, that tends to be the one that causes pain on the inside of the knee. It's quite a common back injury as well. So sometimes these injuries aren't always as they seem. Now, ways to know if this is a problem: if you have pins and needles and numbness as well, that can often be a sign of a back problem. It can also, you might have noticed that if you bend forward, your knee pain gets worse. So if you bend your spine or if you lean back, your knee pain gets worse. That can sometimes be a sign that it's your back that's to cause, not the knee itself. But really, you should get this checked out and have it looked at so you make sure that you're not treating the wrong place. Anyway, that's all I've got for you today. Those are the most common injuries to the inside of the knee. So we have knee arthritis as number one, an injury to the medial meniscus as number 2. We have a medial collateral ligament injury as number 3. We have a patellofemoral joint problem as number 4. We have a referred pain from the hip as number 5. And finally, referred pain from the lower back is number 6. So those are the most common causes of pain on the inside of the knee. Again, if you've liked this video, please do subscribe to the channel as it helps me reach more people. And if you want more tips and guidance on injuries, just like the ones we've spoken about today, you can pick up a copy of my book. It's called Thriving Beyond 50. It will give you loads of tips and strategies to help with knee problems. And you can find that on Amazon using the link below this video. Anyway, that's all I've got for you today. Thank you very much for watching, and I look forward to speaking to you on the next one.